How do I replace missing teeth? Well, there are three ways: implants, bridges, and dentures. So what's the difference? Well, implants are titanium screws that essentially are screwed into the bone and they replace a tooth or multiple teeth, sometimes a full arch, and they don't interact with other teeth. They essentially are their own standing thing. They work really well. In terms of their long-term survival, you're looking at around about 95% of them are still there in 10 years. Pretty good survival rate. That does though mean if you're one of those 5%, it might not last. The drawbacks, the cost. They are expensive. Cost-wise, you're looking at around about £2,500. It is also a surgical procedure and it's not suitable for everybody. Things like smoking, gum disease, and poor bone quality, or poor amount of bone, can affect if you're able to have implants. Bridges use an existing tooth to support a false tooth next door. They are great when implants aren't suitable for you, or if the teeth are in favourable positions for bridges. There are two main types of bridges. You have conventional and you have adhesive. I'll go through conventional first. With a conventional bridge, you have the tooth that's the support tooth, and you prepare that tooth around the sides of it and also the top of the tooth. With that, it's essentially preparing it for a crown, which is a cap that goes over the top of the tooth. There are risks involved with that. Whenever you prepare a tooth for a crown preparation, there's a risk of the nerve dying off. For bridges, it's around 15% chance risk of that nerve dying off. What that means is it might be needing a root canal treatment in the future. For conventional bridges, in 10 years, around about 72% will still be there. Cost for a conventional bridge, normally around £1,500. Now, adhesive bridges. I do a lot of these myself. They essentially are a more modern technique and they're a lot more minimally invasive. We do very slight preparation sometimes just to make sure that it's all nice and parallel, and then we use a wing, metal or ceramic, and we bond that onto the tooth behind. So we don't need to prepare the whole tooth for a crown. It's essentially just bonding on to the outside of the tooth. They tend to last really well, and for front teeth, where there's less forces, the survival rate for those over 10 years is 95%. The drawbacks of an adhesive bridge is sometimes they can debond. What that means is it might fall out. Now normally we can rebond that one on, but the survival rate for a rebond doesn't normally last as long. The bonding's not quite as strong the second time around. Cost-wise, for an adhesive bridge, you're looking at starting price of around £1,300. Dentures. They're something that you can pop in and out to replace multiple or even just a single tooth. There are three main types of dentures. So you have metal, cobalt chrome dentures, you have acrylic dentures, and you have flexible dentures. Cobalt chrome dentures, they rely on teeth to clasp onto to support the denture. Personally, they're my favourite types to make. My patients find that they get on the best with those dentures. They clip in nicely and you can take them out as well. They don't tend to move around while talking as much, and they also stay a little bit more stable while eating. Acrylic dentures aren't as stable as those metal frame dentures, most of the time anyway. They rely on suction a lot more to keep them in. They also don't rely on the teeth as much. Sometimes having one or two teeth can help support it a little bit, but often it's the suction that's the most important. Flexible dentures are one that I personally avoid. I tend to find that they aren't as good long-term for people. They get a little bit more grubby because they're a little bit more porous, so they end up getting bacteria in them and issues around cleanliness. They also have a reputation for being known as gum strippers among dentists, and that's essentially because where the flexible dentures clasp onto teeth, they end up rubbing up and down onto the teeth, and that can cause trauma to the gums, irritation, and essentially the gums being stripped up, which can also eventually lead to tooth loss and issues around the gums. The benefits of a denture: it's the most cost-effective way to replace multiple teeth. Cost-wise, for a metal framed denture, you're looking at around about £1,300. For an acrylic denture, anywhere from £700 to £1,200, depending on how many teeth and the styling you want. For a flexible denture, I don't personally do them, but it's in the region of £1,000. The drawbacks of dentures: They have to take them out at night time. They are a little bit more bulky. They also can get food stuck underneath them. They can also be a little bit more troublesome day to day. A denture normally lasts around 5 to 10 years. After that period, they start to not fit quite so well as the bone and the gums underneath the denture change over time. So which one's right for you? Honestly, it depends on the size of the gap, your overall oral health, the bone, what you're wanting day to day, and your budget. Best thing to do is to book a consultation with your dentist and ask them what's going to be right for your situation. They'll take a little look and recommend what option is going to be the best for you. Thank you very much for watching.